Ladies and gentlemen of the press, let me welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, the 6th of July, 2020. As we progress into the second phase of the eased lockdown, the national response continues to escalate its level of vigilance and monitoring, especially as we ease restrictions in more sectors, including those with potentials for large gatherings and all interactions between groups of people. We are conscious of the fact that this could be misinterpreted to mean that the war against COVID-19 is over. But let me emphasize, ladies and gentlemen, that the decision for further relaxation was consciously taken by government to balance lives and livelihood. And the rising global and domestic statistics of cases and fatalities have shown that COVID-19 has not given any relaxation. Therefore, we cannot afford to slow down, and we must never compromise. Let us continue to learn from history of pandemics by avoiding the mistakes of 1918, when after there was an ease of the relaxations or the restrictions, people jumped onto the streets, dancing and jubilating and romancing with the Spanish flu. Having laid that foundation, the Presidential Task Force calls on all Nigerians to remain vigilant, and this call is underscored by the global and national developments in the last 1 week, especially throughout the weekend. In the last 1 week, we have witnessed a resurgence in countries that were noted as having successfully contained or containing the spread of the virus. The situation in Beijing, China, and the United States of America should inform our individual and collective actions. Of course, such resurgence have led to reintroduction of precision or location-specific lockdown in some areas, such as parts of Galicia region in the Catalonia province of Spain. Of recent, we have witnessed a high rate of positive cases, especially among people in authority. This has a direct impact on governance and security of our nation. We urge that vigilance and care should be exhibited by all Nigerians irrespective of status. This virus does not discriminate, and the Presidential Task Force shall keep sustaining its sensitization messaging. This morning, the Presidential Task Force met with the heads of security and defense agencies to review and chart a refined course in view of the fact that COVID-19 is a global health and socio-economic and security issue, and Nigeria must continue to evolve new strategies peculiar to her environment, even while working within global prescriptions. Over the last weekend, the Nigerian Interreligious Council organized national prayers for both Muslims and Christians to seek divine intervention on COVID-19 and several other problems confronting our nation and humanity. The Presidential Task Force thanks the Nigerian Interreligious Council, NIREC, under the co-chairmanship of His Eminence, the Sultan of Sokoto, Alhaji Saad Abubakar, who is also the chairman of the Spring Council for Islamic Affairs, and His Eminence, Dr. Supo Ayokole, the President of the Christian Association of Nigeria, who is also the President of the Baptist Convention, for dedicating 3 days to seek the intervention of God by healing our land from the impact of the coronavirus. Some additional benefits derivable from the intervention of NAREC include awareness on the evil of gender violence, benefits of peaceful coexistence, religious tolerance, and deepening the impact of community engagement and risk communication programs of the PTF. We continue to receive support from kind-hearted Nigerians, development partners, and other interest groups. On Friday, 3rd July, the Nigerians in Diaspora COVID-19 Support Group donated personal protective equipment worth 48 million naira, which are already being distributed to all states of the Federation as prescribed by the donors. The Presidential Task Force appreciates this effort and welcomes other willing donors to join the battle. The PTF informed you last week that new protocols will be released regarding how the aviation sector will safely reopen, bearing in mind global standards on safety and security. The Ministry of Aviation has released the protocol and shall begin to run public sensitization on it. We urge all travelers to study the protocols carefully and comply. We shall be putting in place critical measures to mitigate the risk associated with travels. Later this week, on Thursday and Friday, 9th and 10th of July, the Presidential Task Force will be carrying out its midterm review, having crossed the 3 months half-time threshold of its lifespan. This will involve a comprehensive examination of the steps taken, the challenges, and charting the way forward. Once again, I wish to reemphasize that COVID-19 is not a death sentence, but it becomes dangerous when we fail to detect, test, isolate, and treat. We can avoid contracting it by complying with non-pharmaceutical interventions of wearing a mask and maintaining social distancing, hand washing, staying and working from home if practicable. Similarly, we can achieve more if we stop stigmatization. Capacity and opportunities for testing have been expanded, with the opening of 40 laboratories now and creating of more testing centers, including some certified private sector medical facilities. I therefore encourage all Nigerians to get tested to enable us fight this pandemic. We have done it before, and we shall do it again. The handling of the Ebola virus, Lassa fever, our becoming a polio-free country, a successful exit from other communicable diseases over the years should give us comfort that COVID-19 would also be put behind us. I now have the privilege to invite the Honorable Minister of Health, thereafter the DG, Nigeria Center for Disease Control, and the National Coordinator of the PTF to present their updates. Thank you for listening.
Our honorable ministers here present, permanent secretaries, director general, directors, national coordinator, ladies and gentlemen. As of today, the 6th of July 2020, Nigeria has recorded a total of 28,711 confirmed COVID-19 cases out of 152,952 tests conducted, of which 11,665 have been treated successfully and discharged. We have regrettably recorded 645 fatalities. Taking the statistics of the month of June alone, where a total of 15,532 cases were confirmed from 74,580 tests, with 303 deaths on record. It means that just under half of the total fatalities so far recorded occurred in that single month of June, while we more than doubled the tests done and the number of cases detected. The reduction in case fatality rate is down to about 2.2%, as opposed to about 5% we have seen on global average. And it is in line with our plan going forward. But it also draws our attention to the speed with which COVID-19 is growing, the time it took to double itself, and the reminder that we need to improve on our responses in order to continue to strive for the best and prepare for worse. It is also the plan of the Federal Ministry of Health to boost overall COVID-19 sample collection by preparing all eligible public and private hospitals nationwide to become collection centers. This will require enormous work with state governments and NPHCDA to identify the facilities that can be used and the space within them, and also to conduct training for the personnel selected and supply a supply chain for both PPEs and sample collection kits, as well as the all-important logistics to go around to recover test samples and so to better utilize the available laboratory assets in the country, which even now are capable of handling far more cases than they presently do. If logistics around sample collection and delivery to localized test sites are better organized, a lot more will be achieved. However, the more we test, the more confirmed cases we shall find, of which the vulnerable will have to be prioritized for admission to treatment centers, even if they are not yet showing symptoms. Quite clearly, the earlier we can put those who are vulnerable under observation, under medical observation, the better the outcomes will be. States will therefore be encouraged to use all opportunities to isolate other asymptomatic cases who may not qualify for supervised self-isolation for the period they are deemed to be infectious or are at risk of infecting the vulnerable. It will also mean scaling up treatment and isolation centers in all states and the logistics for managing the centers. With regard to certain petitions and reports available to me, I need to here appeal to citizens, especially those COVID-positive patients who feel those symptoms at all, not to take invitation to treatment centers as persecution or as punishment, but to cooperate with health officials and understand that measures taken are protective measures and the interest of all of us. A strong 17-man team of the Federal Ministry of Health, led by the Executive Director of National Primary Healthcare Development Agency, left Abuja today for Calabar to engage with Cross River State Government in setting up their COVID-19 response strategy and aligning it with the national response. Agencies and many departments of the ministry, such as NCDC, hospital services, family health, are represented in the delegation, to ensure the appropriate technical handshake between federal and state cross-river state service delivery pillars, and also to ensure that the disruption of routine medical services, which has been observed in many states, is minimized or eliminated in cross-river state. We have also called on the cross-river state NMA, Nigeria Medical Association branch, to suspend their strike action and receive the ministry's delegation arriving there today. At the request of His Excellency the Governor of Cross River State, a senior immigration officer is also in the delegation to study the border challenges with Cameroon, as well as a port health officer to assess the risks posed by sea travelers arriving Cross River State ports, particularly from neighboring Central African countries like Congo, Gabon, Cameroon, Angola, who are felt to be unsupervised visitors entering the country. Cross River State is also known to produce certain varieties of personal protective equipment, including masks, for which the governor requested Standards Organization of Nigeria endorsement to have access, so as to have access to broader patronage. Therefore, a person from this organization is also on the delegation to Calabar. With regard to Kogi State, arrangements are underway to beef up security at Federal Medical Center Lokoja for the protection of staff and patients. The federal government will do all it can to attend to the needs of the citizens and restore service, full service, while we seek ways to engage the state authorities for attending to the needs of the citizens. The unfortunate figures of COVID-19 we see in other countries every day are sobering and must instruct us that it is not the way we want to go. To protect ourselves more, I must advise citizens again that it is not enough to ask, what is government doing? The question is now also, what are you doing? Whether as communities, associations, or individuals, we are all in this together. And it is not the federal government's assignment alone. This novel virus is highly contagious. And if we do not cooperate, work together, and make sacrifices, if we refuse to get tested or treated, if we decide that whatever we do infects others, any one of us could be responsible for some of the cases leading to death in this country. The federal government, through the NCDC, has launched an e-learning platform on infection prevention and control for healthcare workers. We urge them to utilize it, but we shall also refocus on training states with high health worker infection rates. Infection rates in our treatment centers have, however, generally reduced. PPEs have been distributed to health facilities in good numbers, and their use is being monitored to reduce wastage. I urge our health workers to ensure their appropriate use. I also particularly warn against unprofessional disposal of used personal protective equipment in common waste dumps, where scavengers have been seen to pick them up for their own use. This is dangerous and a sure pathway to promoting community transmission. All COVID-19 waste is to be incinerated, whether with factory-made incinerators or improvised incinerators. I also remind everyone that COVID-19 treatment facilities who are not accredited by the responsible state or the FCT accreditation committee are illegal and risky. Finally, I wish to remind everyone that government-run testing for COVID-19 is free. Please report anyone who demands payment for necessary action. Thank you all for your attention.
Administration and Chair of the Presidential Task Force, Honorable Ministers, gentlemen of the press, thank you again for joining us this evening for today's press briefing. So today I'll take on two very important topics. One is today we are announcing and launching new guidelines for the conducting of elections during the COVID-19 outbreak in Nigeria. As you're all aware, some states will be holding state and local government elections this year. For the first time, we're holding elections of this significance during a pandemic. Therefore, we've developed these guidelines to support everyone involved, political parties, INEC, but most critically, Nigerians that will be going to vote in these difficult times. Voting still remains a civic responsibility, and even though we're in the middle of a pandemic, we have to find a way of doing this safely. We have to adapt to the new normal. And as we know, the virus thrives in mass gatherings. So there's a challenge that we have in the way we have conducted our elections pre-election, during election, and post-election. So in these guidelines, we try and offer advice on how to do this safely. We strongly encourage the use of TV, radio, mobile vans, social media, and other forms of communication as we solicit for votes, as our politicians solicit for votes. We advise careful adherence to mass gathering guidelines. Unfortunately, the virus doesn't really recognize whether we're conducting elections, whether we're in religious gatherings, whether we're in business settings. It just thrives when people come together. So we have provided specific guidelines for these settings. None of them will be surprising, but we've been explicit about it. And finally, in this particular case, we really want to urge our politicians, our leaders, to take responsibility and lead by example. Leadership will be critical in this era. And we're asking you to please think of the lives of the electorate first. The electorate staying alive is much, much, much more important than any vote you can win. So let's take that into consideration. Look at these new guidelines that have been very well considered and consulted on, and I hope they can lead us to safe elections, at least from a public health perspective. The other thing is on the infection prevention and control course the Honorable Minister has just announced. We have a new online course that we've been working on for months. This new infection prevention and control course, while targeting healthcare professionals, will be enjoyable to anyone that has an interest. It is done for Nigerians, by Nigerian actors, acting out the scenes in Nigerian hospitals and healthcare settings. There's never been anything like this. It brings infection prevention and control to your doorsteps and the consciousness of everyone. We have worked very hard on this, making sure that the examples are examples that each of us will be familiar with, so that if you have a challenge in your office and you want to understand how to decontaminate your office after an event, you can go onto this course and learn how to do it. So it's open to healthcare workers, open to any Nigerian. because IPC is one of those areas that we don't really see as an outbreak response. We really want to transform how Nigerians, doctors, nurses, but also patients relate to infection prevention and control. We want next time patients go to a doctor, they know exactly when to insist that that doctor wears gloves, for what procedures he should be wearing a mask, and for now, obviously, he should be wearing a mask all the time. So our work around IPC at the Nigeria Center for Disease Control actually started over 2 years ago with a project we called Turn Nigeria Orange, where we started preaching this gospel of IPC. Since the onset of this outbreak, we've trained over 15,000 healthcare workers across the country, and this is a process that will be ongoing until we cover as many healthcare workers as we possibly can. Within NCDC, we have created a whole new unit that focuses and will continue to focus exclusively on infection prevention and control, because this is one area that we have neglected for too long. We want to strengthen, and we feel we're in a good position to do so. The work that we're doing on IPC has been recognized across the world, and the Africa Center for Disease Control has asked us to lead on the expansion of the strengthening of IPC across the continent. So we're now leading on this pillar for the Africa Center for Disease Control. So if one good thing emerges out of this outbreak, is that our relationship to IPC will never be the same again. IPC should not be a public health response. It shouldn't be an outbreak response. It should be something that we do every day with our engagement with healthcare workers. So with these two things, on election, on infection prevention and control, these are two examples of a new continuous quality improvement mechanisms that we hope we're introducing both into the health sector and into the response to this outbreak, and to improve our public health moving forward. Thank you very much.
Members of the PTF, gentlemen of the press, good evening. So today we have a special message to traditional rulers and our community and religious leaders in the fight against COVID. As we know, knowledge is power. Having information is power. It allows us to be able to live a safe, healthy, and productive life, even in the era of COVID. Since the beginning of the pandemic, the PTF has relied on a scientific and data-driven approach to provide advisories to Nigerians in order to mitigate the spread of the virus. We have continued to equip Nigerians with COVID-19 prevention and control messages through various channels. So, for instance, we have developed countless digital, audio, and print awareness materials that have been distributed in English, Hausa, Igbo, Yoruba, Pidgin, and other local languages across traditional and new media channels in the country. The PTF has also been working closely with donor partners, the private sector, state governments, civil society organizations, and many other partners for grassroots sensitization campaigns in all the 774 local government areas. This is because we realize that public awareness campaigns, improved risk communication is a major driver for bringing down the current infection rate we have, because it's all about behavioral change. However, the PTF cannot be everywhere. We cannot be everywhere to drive down sensitization in every nook and cranny of the country without the critical partnership of the traditional rulers, our community leaders, and our religious authorities. So what's the message? We are appealing to all traditional rulers, community and religious leaders who remain integral points of influence in their rural communities as well as their urban communities to join the fight by driving the sensitization programs right down to the grassroots as it relates to COVID-19 prevention. The PTF would like to see religious and traditional figures incorporate our life-saving health advisories in their messaging to their worshippers and community members. This should be considered an opportunity at every prayer session in the country. Specifically, we need the knowledge of Nigerians to improve in terms of the symptoms for COVID. What are those symptoms? Dry cough, fever, shortness of breath, loss of smell or taste, chest pain, and many others. The task force also appeals to religious leaders and our traditional institutions to encourage compliance with our approved protocols. These include wearing a face mask appropriately and all the time in public spaces, maintaining physical distancing, avoiding mass gatherings, washing hands frequently with soap and water, practicing hand sanitization, and disinfecting surfaces, particularly working surfaces. We urge our community leaders to please work with us, whether it's from the traditional institutions or from religious authorities, to help us to stop this pandemic. We should always remember that your actions or words can lead to non-compliance of COVID-19 prevention advisories, which could potentially lead to avoidable deaths. So on behalf of the PTF, I'd like to thank all our traditional rulers, our community and religious leaders who continue to work closely and partnership with us. When we do finally get this pandemic over, and we will, history will remember all of you as among those that have fought hard in the interest of saving the lives of our citizens. Thank you.
Well, gentlemen of the media, good afternoon to you today. Thank you very much. Now you know that we are starting to open up slowly. We are beginning on Wednesday, a day after tomorrow, with the domestic operations. I'm happy to announce that the two airports involved that will start, Lagos and Abuja, have passed our tests and they have been approved for operations. Some of the airlines also have been approved to operate. So Lagos, Abuja, Kano are ready. Port Harcourt, Owerri are almost ready. They will be ready before they start. Kano got ready ahead of its starting time. But remember that we're beginning on Wednesday with Lagos and Abuja. So how are things going to look like? For emphasis, there's really nothing new. But for emphasis, you get to the airport early enough, your temperature will be taken, you'll be observed to see whether you're showing any symptoms of COVID-19, which by now are very well known. You will be having your mask, this face mask, which must be worn properly to cover your nose and your mouth, not on your chin. At all times, within the vicinity of the airport and inside the aircraft, you must have your mask on. It's a fundamental requirement. You'll be cleaning your hands frequently. There will be hand sanitizers in washing areas. You can wash your hands and also keep cleaning your hands. And you must be physically distant at all times whilst you are within the airport. You will approach, as we have seen in the dry run, you will approach the terminal building in a physically distant order. You'll be keeping 6 feet or 2 meters as it were, and they are all properly marked at the airports. So you must be on those spots and wait for a spot to be empty before you move to it. Meaning that the first guy will move forward to create a space for you to also move. And they're all clearly marked. And there will be extra hygiene, cleaner of surfaces. So we know that this COVID guy, so long as we clean our hands and sanitize them, wear our masks, since he's a droplet, would be physically distant, will be almost free from him. So we know that we are a highly regulated sector. We had consulted and followed all international protocols. You've seen many countries luckily now have started. Within Africa, more than 5 countries have already started commercial operations within their country. And around the world, nearly half of the world, about 100 countries, have already commenced domestic operations. We were not quick at starting in Nigeria because we want to get it right. We don't want to risk the life of anybody. We believe that we should do it right and ensure that everybody is safe. So, including when you go to get, we encourage you to check in online, print your own boarding pass, and come to the airport. At a point when they need to see your boarding pass, it will be you, the passenger, that will cut the boarding pass and hand over, so there is no contact between you and the person. There's also a screen between you and the people checking those boarding passes. So you will board accordingly, maintaining physical distancing. Now, to the question on how the seating will be in an airplane. Everything that we do in civil aviation, of course, is backed by pure science and technology. And science and technology is factual. There's no error of margin. And to maintain you living healthy within the cabin of airplanes didn't start with COVID-19. Long before now, for people who have been following civil aviation, they remember in 1977, the Alaska story, where somebody sneezed and got influenza, blah, 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 and so on and so forth. So civil aviation has been well ahead, more than 4 decades, more than 40 years, improving on your safety within the cabin. That's your health status within the cabin. Part of what civil aviation had done, one is to ensure that the air within the cabin of the airplane is being filtered and circulated. What is the kind of filtration that we have in there? How is it circulated? Because let's even not talk about COVID. Let's talk about common colds. If I sit in a room with you, you sneeze, chances are that I pick it. Contagious. So similar with COVID. Now, what did we do in civil aviation? First, the ambient air as you fly in altitudes is of course clean, because it's not contaminated by what we do here on the ground. So air, fresh air, clean fresh air is ducted into the cabin, is compressed. During that compression process, the temperature, of course, will rise. All of us who have elementary science knows that once we compress, we heat it up. And that heating goes to about 200 degrees centigrade. 200 degrees centigrade, twice boiling water. Even that in itself, the compression itself, will kill some germs or viruses or bacteria or whatever it is, organisms. Then it is suddenly cooled to about 2 degrees centigrade. Then it is passed to us. And it comes from the top of the cabin downwards. It washes downwards as it falls. And it exists beneath us on the floor. Some along the side of the fuselage, the cabin inside, at the sides, but it flows from up, down, and goes out. It's being circulated also at least every 2 minutes. Every 2 minutes we are having clean, fresh air into the cabin and out. Some 30 times in an hour. Or if you like, about 35 times between Lagos and Abuja. So this air is circulated clean and fresh within the cabin. And this is pre-COVID-19. This is how airplane air is being circulated. So what is our scare, what is our fear with this guy, this COVID guy? Our scare and our fear is that once he drops from a cough or from sneezing, and we touch him and touch our eyes and nose and ears, or whatever part of our body, especially the face, mouth, nose, and eyes, we will pick him, this COVID guy. So, we know that if we have our airplane decontaminated before you board, and decontaminated as you exit, the surfaces that you'll touch, like the doors of the toilet, the armrests, etc., are being frequently cleaned with the right chemical to kill those viruses in case they're there. And all of us, without exception, is putting a mask. And that we have not shown any sign of COVID-19 when we board, we are safe to be in that cabin. We would run away from COVID, almost 99.999%. So being in an aircraft cabin is as good, actually better than being in an emergency unit in a hospital, which is also being cleaned and air is being circulated. It is safer to be in there, in terms of that quality of air, than you be in a theater room. So certainly it is better to be in there than be in your offices, or even in your homes, or even here where we are having this press briefing. So it's very safe to be in this cabin, very, very safe to be in aircraft cabin. So what we must ensure that we do, and what we are doing, is to enforce, to make by force for you to wear that your mask while you are seated. To ensure and enforce that you are wearing that your mask. So we put everything in place to ensure, because we have some cantankerous passengers worldwide, not peculiar to Nigeria, that want to use their phones when we say don't use phone, because they don't see the reason. Well, thank goodness, with COVID, you have seen the reason, because you know people die. So it will be very, very hard to ensure that you put your mask while you're seated. If you don't, we consider you as an unruly passenger. An unruly passenger is not allowed to board our aircraft. Once you are an unruly passenger, if you start to shout, just shout, yeah, and you're disturbing peace of aircraft, no, the captain will not go, you'll be dropped. So, not wearing a mask, you are considered as an unruly passenger. And somehow, when International Civil Aviation Organization, ICAO, was trying to enforce this unruly passenger to come into effect, they were short of one country to sign the document and to make it into force. And that country was Nigeria. And the person who signed it was Hadi Sirika, your present minister, in 2016. Musa, correct? So that's what we did. So we ignited that component of act that says if you are a unruly passenger, you must be dropped. And I signed it. Therefore, it's an extension of that, my signature on that document, that I will enforce and make sure that passengers remain obedient and wearing their masks. So once you have your mask, then we do know for a fact that we are safe, then we'll carry out our businesses as usual. We will allow the last row in the cabin of the aircraft free so that we can isolate just in case we see something that looks like symptoms within the cabin. So we don't create panic. We will create a row behind, then we isolate you there. Our cabin staff are well trained to do this, to look out for this. Remember, I told you here on this platform, the cabin crew, their job is not to offer you tea. They came into the industry because people were getting air sick, and we thought we would be putting nurses in the airplane to be looking after those people who are sick. That is back in time. And since then, they metamorphose. They become something new. They want to now give you tea, because many people don't get sick anymore. They give you tea, they give you coffee, they give you food and drinks and so on. So the main purpose of the cabin staff is to ensure that we all remain safe and for your welfare and your health. So they've been trained to do so, to give you that service. They're well trained to give you that service. And for these domestic operations, there will be no food. No food will be given so that we reduce the contamination level. And we will allow you to come with your mask. Reason being, like the MD of FAN had said the other day, we see it as your private thing. It's likened to your underpants. So it's private to you. So you bring your mask. And these masks, they don't have to be the fancy ones. You triple the cloth, sew it and wear it. Wash it when you get home and rewire it, so long as you wash and iron. So you come with your face masks. As an option for double protection, if you have the chance, you can wear this, the face shield. As an additional safety, you must take the SGF, who is the chairman of PTF, had been insistent that you must take responsibility. Dear Nigerians, please do so. Take responsibility. Ensure that you've done your bit. And this is service. This is number one service that you're giving to your country, to ensure that the country remains healthy. It's not only about yourself, it's about your neighbor and your friend. So once you are within the cabin, please take responsibility. So this filtration system within the cabin is done, like I said to you, when you duct the air, you compress it, it's heated up, you cool it, and you pass it through a special filter. It is high efficiency particulate air filter, or some call it Arresto air filter. And this filters anything between 0.1 to 0.3 micron. So therefore it takes out 99.999% of all organisms, including viruses like COVID, bacteria, and so on and so forth. And this is studied by, of course, the US CDC, WHO, IATA, ICAO, and so on. It's been proven that this high efficiency particulate air filter is that efficient to take out 99.999% of all of these organisms. So it's good news for us. So we know that we are starting on Wednesday domestically, and so we know that our cabin is safe, and so we know that we are good to go. Now, we are going to also sequence our flights, arrivals, and departure. And the reason is that we don't want to flood our terminal buildings. So we'll use Nigeria Airspace Management Agency, their own procedures and process, to ensure that sequencing of flights are done. They will come in predetermined and go out predetermined, so that we know the amount of passengers we are emptying into our buildings, so that we ensure that the physically distant positions that we marked are respected. We don't have a case where we have overflooded the terminal buildings and passengers are having to stand and break those protocols. We will not allow it. We will ensure that it is done. Furthermore, President Muhammad Buhari has approved, and this is a very serious matter for us, the hitherto big men, especially military men, ministers, members of the National Assembly, and the judiciary are culprits. They have all these, their PAs and SAs, returns of people that are not traveling, and they insist they must take them inside and onto the aircraft by protocol. This will not be allowed, will not be permitted, they will be stopped. I believe that, not because I am the highest guy in protocol, but I believe that within the purview of civil aviation, I should be first to enjoy those services of protocols. But for the last 5 years, everybody that has seen me at the airport has seen me alone. I don't travel with PA or SA or anybody. I travel by myself. I carry my box by myself, because when I go out of the country, I do it myself. So I do it here as well. Domestically, I carry my box, I go everywhere. So please, ladies and gentlemen, for those of them that I know maybe they are challenged physically, they can go to a certain limit, but they will have to cede it. We will allow porters to assist them, and those who are diplomatically allowed, diplomatic services will be also rendered. So you have no need for your aid, because your aid, even if he attempts, he will not come in. And by the way, of course, firearms are not allowed in our vicinities. In the first, they come, and the culprits, I insist, are ministers, military men, National Assembly, and judiciary. Because we had only one encounter or so in recent history with the police, and almost none with the DSS, talk less of NIA. So these are the culprits, big men, and governors, yes, governors. Yeah, governors. So governors, please, we will not allow your aides to be in our airport, talk less of being in an aircraft. So I think I've spoken much for today's briefing, and I do believe that you've been doing a great amount of job. The last one is, the buck is on your desks. Gentlemen of the media, you will have to keep assisting us like you did before, to allow us to use your platform to continue this campaign, for people have to understand what we're trying to achieve, to also understand that they are safe when they sit in airplanes.
It's only befitting that after that long lecture, I come and announce the dates for WAEC exams. From the 4th of August to the 5th of September. Parents, please take note. Last week, the chairman of the PTF announced that school facilities will be available for those who want to go into revision classes. As soon as we conclude WAEC, we will take up the NAPTEB and NACO exams. The idea here is that we have a whole month from now till then. Those who can and those who are willing, the states who are willing, should make their schools available for their children to revise. We've done the most we can with our representative at WAEC, and we have this afternoon confirmed that the dates allotted for the exams will be from the 4th of August through to the 5th of September. Local timings will be published. From tomorrow, this is part of what we are taking into our concluding stakeholder meeting tomorrow with NCDC, Nigerian Union of Teachers. Everybody will be on concluding stakeholder meeting tomorrow. And these dates are what we're going to take into those. We'll be asking that those who are not prepared yet should please go and prepare. We're continuing with registrations for NACO. For those who have not concluded registrations along those lines, kindly get your, this is the time also to update and get your registrations done. Thank you very much.
about the criteria for testing persons who are suspected of having COVID-19 infection. You know that a target of 2 million tests was announced some time ago. That 2 million is equal to 1%, estimated 1% of the population. It was not just a random figure. And that is also what is generally recommended. If you can test 1% of your population, then you have actually meeting a certain benchmark. Now, at the very beginning, when we didn't have community transmission, and we had only random cases and very few test kits, very few reagents were targeted in testing who had traveled, who had just come from abroad and showed symptoms, because not everybody who came abroad was tested. They were at home, and then if they showed symptoms, they were tested. And then the contacts who were observed and they showed any symptoms. But now that has changed. We are now in the phase of community transmission. It means that this is now almost like an indigenous disease, and many people are handing it over to each other. The imported cases are now very few. They are by far in the minority. And the criteria have changed. Now, the first thing is that anyone who has a symptom, and we have said the symptoms will be a mix of fever, cough, and loss of sense of taste or smell, and then above all, the breathlessness. Now, anybody who has those symptoms goes to a testing site will be tested, definitely. If you have also been in contact of someone like that, let us say you lived in the same household with that person, you are also eligible to be tested. And or if you came from abroad, as you know just now, those who just are arriving are being tested after arrival from foreign countries. Now, we have more test kits and reagents, and we have reset the criteria, and it is still to be targeted anyway, because the fact that we are testing 2 million doesn't mean we are just randomly testing any 2 million. There still have to be certain criteria. So you must actually be able to meet certain reasons to suspect that you may have contracted this disease, so that we don't waste test kits. Part of what has been studied here is the yield. If you test 100, how many really do you get? Some countries get 10%, some get 15%, some get 30%. I mean, I think one country has 50% or more, or some 6%. So it depends also on the fact how efficiently are you using your kits. So that's a question you'll be asked when you go for testing. Have you any reason to want to be tested? Now, the question of the health workers in Calabar about politics, well, politics should not be in this at all. There should be no politics in responding to a disease, particularly one as infectious and contagious as COVID-19. So we want to remove it from the realm of politics and everything else, and religion, and face this disease and the threat it gives to this country. We know at one time that the health workers complained, I mean, that they were not seeing progress in certain states in response. And it is part of that that has led to strikes in various areas. You know, there were strikes here and there. Some of it was over pay, others was over equipment, other personal protective equipment, and so on. So the response of the government is to make sure that first everybody has the PPE they need, and you have your pay as agreed, and also you have your training, and you have your instructions and your, if possible, your targets. And that should solve the problem and take the entire COVID-19 response away from politics. Now, the other question about Madagascar, well, the research is going on. And if you are conducting research, you don't just go and say, give me money, and they give it to you. You have to make a case for it. You have to prepare a proposal that to convince those who are going to give you the grant, you have to get the grant, that yes, what you want to do is reasonable, is useful, and then the path that you are going to take is a sensible path. That's why you have a health research committee in the Ministry of Health that shows that yes, what you want to do is worth it, and then the probable cost of it will be examined by a panel, and before anyone will consider giving you your grant, there's also an ethics committee that looks at whether what you are going to do is good or dangerous, because there are also dangerous research that goes on that produces terrible things that particularly they use for war. So there's also, and in medicine also, there's ethics that also will examine, particularly when you are doing your clinical trials, whether you are not endangering the lives of people who are volunteering for clinical trials. So all those things have to be taken into consideration before anybody gives you money. So between last Thursday and today, it hasn't taken place, but it's going on that they present a case for it, and then the COVID PTF has good plans to also respond to R&D, that's research and development, which is one of the pillars of the PTF response. Now, the other one is about rejection and referral. Well, there's a good difference between rejection and referral, because as a doctor, I know that myself. In that if someone comes to you, you examine them and you see that you do not have the capacity, the knowledge to treat, then you refer them. Usually you give them a note telling them where to go to and who to go to. The referral is to a person, to a doctor, if possible, or at least to a facility. But once you look at somebody through the window and say, no, we don't do that, then that's rejection, because you have not given them a chance at all. Sometimes you have not even asked them what they're there for, and you are telling them to go away. That's rejection, and that is what we do not like. Everybody has a chance, a right to present their case and to be heard, and then for them to have preliminary examination. And if it looks like their life is in danger at that moment, their life is in danger, you have to take them out of danger. If they are breathless at that moment, you must give them oxygen if you have. And if you do not, you call an ambulance for them or seek an ambulance. You don't just tell them go away. So there are ambulances in many places, and Ministry of Health is working now on creating an ambulance system that, and first aid and ambulance system, emergency medical treatment and ambulance system that you can call to take persons like that. You don't leave them to their fate, and some of them do not even move a few steps from the doorstep of the hospital when they give up. So we do not want rejection of patients. Citizens are entitled to their lives.
Between COVID and common cold, especially as the rain starts in households. So obviously, we can't really legislate for every specific scenario, but we've been very careful to say these are the most vulnerable people in our context. Even within that, there's a whole scale of vulnerability depending on how ill you are and how vulnerable you are, and therefore that will also lead to decision making in any household, how much you need to protect that person. So if the more comorbidities, the more you have to go the extra mile in the household to protect that individual from getting exposed. We wouldn't recommend generally the wearing of face masks within families, because you are all exposed to each other all the time anyway. But of course, if you have a gentleman or a lady with specific medical conditions that increase the level of vulnerability beyond what is normal, then of course I would expect you to take a lot extra measures and actually restrict the people that have access to him or her for now to a very small group that actually needs to. Many people have limited people going in and out of their compounds and really designated one individual or two to do the shopping. But sometimes it's difficult in our context. So we all have to calibrate the risk with the reality in the households that we live in. The second question was on Kogi and whether we had given up on Kogi. We will never give up on any state. We will never give up on any Nigerian. It will go against the mandate that set up the Nigeria Center for Disease Control. Kogi has 9 bordering states. every citizen, every member, everybody living in that state is a citizen of the Federal Republic. Our responsibility is to continue supporting every state in Nigeria, protect the health of every Nigerian the best way we can. We've just supported the state in setting up gene expert testing site in the state teaching hospital, and we really hope that over the next few weeks the relationship will improve and we can focus on the technical work that we're supposed to do. Like I've said very often, we have no interest in politics. Our role is to protect the health of every Nigerian, and we'll continue to do our best in doing so. There's a question of whether we had met with critical stakeholders. Yes, the wide consultation had happened on the election document, but obviously our role is not to make sure everybody is happy. Our role is really to translate the science in the best possible way for people to interpret. So we're not going to change our guidelines because opinions vary, right? We'll use the best interpretation of the evidence in front of us for the context of elections. We've done the same for religious settings, we do the same for business settings, and that's what we'll continue to do. So we consult, but consultation doesn't mean that we compromise the science for the comfort of the people targeted with these guidelines, because ultimately our responsibility is to Nigerians. And that's what we have clear to us at any point in time. Yes, there was a question around the circumstances of evacuation of patients. I have many responses to that. The first one is that we should be very careful in drawing national conclusions based on WhatsApp videos. You know, this is probably one of the biggest drivers of our reactions these days. And I really urge caution, right? Anybody can put a WhatsApp video together and suddenly we're all expected to react to it as if that's, it's really, I think for you in this room, it's really a challenge for your profession, because in your profession you're also guided by certain ethics. But now anybody can put up a WhatsApp video and we're all reacting to that WhatsApp video as the absolute truth. So back to this particular video, the first thing to say is we have no idea of the authenticity of the video. And even if it was authentic, the responsibility for the evacuation of patients is the state government's in which that video was shot. I don't even know where that video was shot, right? So every state has a responsibility. As we start increasing the inclusion of the private sector in care, you'll find that more people will start evacuating patients with the private sector services. So there's a whole spectrum of possibilities that could have happened. What we don't do as healthcare workers is use force to evacuate patients, to provide them care. That would be a very unusual reaction. I can't vouch for the sanctity of every healthcare worker in Nigeria, but we are not a law enforcement, we are not trained in law enforcement. We never use force to evacuate patients. If we have difficulty and there are specific circumstances because of public health reasons why an evacuation has to happen.
As the chair said earlier, we had a meeting this morning with the security chiefs, and we had a list of requests that we made to the IG of police in particular. And one of the requests had to do with enforcement of face masks. As you know, some of the Southwest governors have already made wearing of face masks in the public compulsory. This was around the middle of April. Prior to that, Lagos and Enugu had already made the wearing of face masks compulsory. Kano, in mid-May, directed security agents to make sure face masks were worn in public spaces. And there's no doubt, at the beginning of this pandemic, there were some controversies as to whether face masks made a difference. But over time, we are all learning from this pandemic. Research so far shows that wearing a face mask in public reduces the transmission of COVID by up to 45%. as far as the PTF is concerned, we will continue to work with state governments to make sure that they have the relevant local laws with regards to the use of face masks in public, and these are enforced. When it comes to the provision of services or to access to public buildings, including commercial enterprises, we expect that people that are not wearing face masks are turned back or denied access to these services. It is absolutely critical that we protect our citizens against COVID infection. When you wear a mask, you're not only protecting yourself, but you're also protecting the person that you are meeting from getting infected. So that's for face masks. Having said that, I strongly believe that the best way to improve compliance with the wearing of face masks has to do with improved risk communication and public awareness. It needs to be voluntary because security agents cannot be with you all the time. So it's all about perception of risk and understanding that if you do get COVID, you are potentially going to transmit it to your loved ones, particularly those that are vulnerable to severe disease. So we'll continue to work on that. In terms of the high priority local governments, as the Honorable Minister of Health said, the number of infections in the country is dynamic, is changing. So when you say 20 local governments are responsible for 60% of infections, it's not going to remain that's the same 20 local governments, because today we may have 27,000 cases in the country. Tomorrow it will be 28 or 29. So these are moving figures. What we have done is to look at a number of criteria, specifically 3 criteria that have been scientifically validated, looking at the number of infections occurring in a local government, looking at the percentage rise in the cases week by week in a local government, and also looking at the percentage positivity. So that's the percentage of positive tests per total tests done. So for instance, if you do a COVID test in a state, so some states have positivity rates of 40, 50%, that means that you are under testing. But ideally, if the percentage positivity is less than 10%, then it means you are testing adequately. So when we look at these figures, we combine the 3 criteria to come up with a number of local governments that fulfill the requirement. So far, at the moment, we have identified 11 local governments across the country, and these are the 11 local governments that we will start working on first. We expect that list to change over time as the numbers change. New local governments will be added, and hopefully other local governments will be dropped along the way. So that's the strategy we're currently applying in terms of local interventions. Thank you.
Well, thank you for bringing me back again. Well, the first question was whether physical distancing will be observed in the cabin. The question has been answered by me, really. That was why I took a very long time to explain to what would happen. So if you like, there will be 2 components of air travel. The one that starts from your home and terminates just before you board the aircraft, which we have explained over and over and over again. And then the one that happens inside the airplane. So the one that will happen inside the airplane would happen this way. You will sit. Once there is space, we will space. If there are no space, we will sit normal, and here is the reasons, or here are the reasons, some of which I explained earlier on. Because the wearing of masks, physical distancing, cleaning of surfaces, washing of hands, use of temperature gauge, etc., were all backed by science and all ensure or make us safe. It ensures that we are safe. So also This is also backed by science and findings, detailed findings. We have explained why risk of contamination is extremely and highly reduced while you're sitting in the cabin. Firstly, just further explanation, it's a very lengthy topic. I tried to summarize it here when I spoke first. So see, as the cabin air is coming down into the cabin, it washes from up down to the bottom. And we're all facing front as we sit. In most cases, except for example in business class of British Airways where you face each other. But that one, you are physically distant anyway. So because we're all facing this way, and the airflow is not from the cockpit to the rear, no. It's from the top down and exits downwards and get recirculated through that filter, that high efficiency particle filter, and comes back in. Because of that, the chances of the microorganisms, the chances of the viruses, the chances of the bacteria, and all of those particles to land at view is reduced even by that system of circulation itself. The barriers are many. The front seat is a barrier as well. And we're all facing that direction, and the airflow is coming down. So, should you sneeze, like we said, you'll sneeze in your masks. So you reduce tremendously. Some of it may escape, yes, but I'm wearing also mine. And once it escapes, the velocity of the droplets will reduce tremendously as it's coming out, because it's being stopped by the mask itself. So velocity is reduced. And the air is washing it down, assuming it comes out. And I'm wearing my own mask as well. So it's like a double protection, if you like. And for a brief moment. And it's being circulated like 30 times in an hour. Or if you like, every 2 minutes. Like I said, from Abuja to Lagos, it happens some 30, 35 times during the travel. So safe to say that no matter how we sit, from scientific viewpoint, which this is all about science and technology, from that perspective, we are safe in an aircraft cabin. How often will cabin crew be tested? They will be tested very regularly. The protocols will be issued out by NCAA. Palliatives. I said that there are two kinds of palliatives. There are ones that we're organizing through Central Bank of Nigeria. That one, and by the way, it's not for airlines alone, no. It's for the aviation industry, including travel agents, ground handling, catering, car hire, etc. And of course the agencies. And so the palliative is total. We're organizing with Central Bank, it's been approved that they will apply for loan, and that loan will be at 5% from 2021. So there's a template, how much they will apply for each airline or each business in aviation, if you like, including ground handling, like I said, catering, taxi, restaurants, and so on and so forth. So everybody that is participating in this air economy, if you like, has been looked up for in these palliatives. The second component is the one that is coming from government through Ministry of Finance, Budget and National Planning, of two kinds. That is still being worked out, and we shall inform you what it is in due course. Thank you very much indeed.
What states are doing in relation to those who have announced that only borders or only those who are day schools should resume. Well, this is an option that is available to everybody. Not all schools are borders. We have 19,159 registered centers for this exam. Many of them are schools. And when my brother, the Minister of Environment, comes on, he will explain to you their plans to decontaminate each of these institutions within this week so that they will be available before weekend. But he will come to do that. But essentially, some of them are not our responsibilities. Some of them are private, are owned privately, and they will take care of what they need to do. The ones that are government facilities will be taken care of differently. But some of them also be, all of the schools are in are in states. States are part of what we do in the Ministry of Education because they are subnationals. If they determine that they don't want anybody doing any revision class, that they are all geniuses in their state, who am I to? If you have a state of genius, very glad. They should walk into the exam and do it and walk away. But if they need to do these revision courses and they figure out how they want to do it, that's also an option. If there are those who are prepared to just walk into the exam that way, that is also an option. So all of these, we're not running a fascist state. We're running a democracy in which we offer our people a latitude of choice within the confines of the regulatory environment. And that's all that the Ministry of Education is doing. We've just told you what the exams will start and when they will finish. Yeah? Thank you. No guru na wiki gara aga izumta na onye ọwụla gee ntị na mgbe a ga-eji elu ule eruwele na onye ọwụla kwado ụlọ akwụkwọ ya ịma ma ọ ga-eji ya mee nnyogharị kụziere ụmụaka ihe iji kwadoro ha maka ule ahụ ka m gwakwara unu taa so rule onomume sị mgbe ọnwa asatọ n'afọ a ga-agba abalị anọ ka ndị WAEC ga-emepe a ga-elega ule ahụ ruo ụbọchị 5 n'ime ọnwa nke 9 ọ ya wụ isiokwu anyị na onye ọbụla ya kwadowe ka a ghara ịwụ na ụgbọ buru na ama unu anwụ.
Members of the PTF, distinguished ladies and gentlemen, the contamination of schools. I remember earlier on I told you we have sat with the Minister of Education a number of times, and we have the list of all the schools that need to be decontaminated and disinfected before resumption. Well, what we plan to do now is to do these centers that will be used. Why we delayed is better to decontaminate and disinfect within a short period of time so that the kids will be going back into these classes while they have been freshly decontaminated. Because the chemicals we use are chemicals that are not long lasting. They have very short time, short contact time that they will do their job. So we will be getting this done before the Monday when they will be back using those classes. So between tomorrow and the rest of the week, we have enough team and people that we will engage to get that done. So be rest assured your kids will be returning into a safe environment when they resume. Thank you.
I had 2 questions. The first one was with regards to evacuation flights and whether there is a schedule that would enable intending evacuees to be able to plan ahead. The simple answer is yes, but of course it's an evolving situation. So, more flights are being added, and so it's changing all the time. But essentially, the prospective evacuees should keep in touch with the embassies, missions, consulates in the countries in which they find themselves. because they are the ones coordinating all these flights. So just keep in touch, and you will have the up-to-date information with regards to flights. And in the one or two cases where we do not have representation, in other words, an embassy or consulate, there is a country, an embassy in a country that is also accredited to that country. So you can also get in touch with the embassy in such a country. The second question was that I think in the specific case of the US was mentioned that it would appear that tickets were given to select individuals. In other words, that the process is not transparent, and the suggestion or allegation that maybe some people are favored. Well, the rule and the mechanism we have in place is that all individuals, evacuees, prospective evacuees, who want to catch any of the flights available pay directly to the airlines involved, not to the embassy, and there's facility for that. So the missions do not get involved in the process of receiving funds, payments for tickets. But nevertheless, I also received directly some complaints were brought to my attention, and I contacted the consulate in New York with respect to this last flight. Of course, they confirmed that payments were to be made to the airlines, but nevertheless, I've instituted an investigation just to make sure that there is no case of of this kind of thing going on. Thank you very much.
The chairman of the PTF, colleagues, ladies and gentlemen, good evening. I have one question, which is in about three folds. One is on the issue of the publication, the release report by UN OCHA on the 7.6 million to 7.9 people in the Northeast that are projected to be in dire need of humanitarian support. Let me stress here that the federal government, under the leadership of President Muhammad Buhari, is doing everything humanly possible to see that they support the internally displaced persons in the Northeast. The ministry, through its agencies, NEMA, Northeast Development Commission, and the National Commission for Refugees, Migrants, and IDPs, have been giving support to the displaced communities in areas of food and other non-food items. Specifically, NEMA deploys food relief on a monthly basis to these displaced communities in the Northeast. It's a monthly food ration that's given to the IDPs in the Northeast. The report is quite alarming and worrisome, but I assure you that we're doing everything possible to see that we mitigate this situation in the Northeast. Just last week, I was in Borno State, Maiduguri specifically, and we took some interventions geared towards alleviating the conditions that these people find themselves in. We handed over to the state government medical facilities that will serve also as isolation centers to the IDP camps, Muna and Stadium IDP camps in particular. We also flagged off the handing over of logistic vehicles and equipments to the military in the Northeast to aid their operation. I also represented Mr. President by commissioning the 10,000 housing units in Borno State. This is all geared towards resettlement and rehabilitation of the IDPs. We've been responding. Northeast Development Commission has been taking different kinds of interventions in the Northeast sub-region as a result of the COVID-19 and pandemic. The other issue is around the issue of the National Social Register, which was expanded to be 3.6 million. This program is an existing program, as I always say, and it is targeted at the poor and the vulnerable across the country. We have expanded by 1 million using the same structure that we have. Mr. President also directed that we give another 1 million, which is now included as part of the economic stimulation program, which is being chaired by His Excellency the Vice President. We are still awaiting disbursement before we start the program. So government is doing everything possible. Yes, the problem is quite huge, but I think we're doing our best, and the intervention that we're taking in the Northeast is really, it runs into billions of naira, because like I said, on a monthly basis, we take food intervention. NEMA does that for the past maybe 7 to 8 years. This is what has been happening. And all these IDPs are being targeted, and they are being given this intervention. Also, with the support of the UN agencies that we are working with, the UN OCHA itself, the World Food Program is supporting. Other NGOs, INGOs are also supporting in the humanitarian intervention. I think I've adequately answered that, and thank you for welcoming me back. I think you should understand that my work is mostly field work all over the country. Thank you very much.
My colleagues have dealt with all the questions variably. I think there is one that wanted details. I think Rachel wanted details of the meeting with defense and security chiefs. I think the national coordinator has given quite an explicit explanation to why we held the meeting. This is part of the routine of the robust nature of the response. We consult with them because the COVID-19 pandemic has brought about not only a health challenge to our country and our people, but also socio-economic issues, and those issues have a tendency of impacting on security concerns in the country. You will recall that during the lockdown, a lot of issues of domestic violence, particularly gender-related ones, were quite obvious. We also discussed the issues of compliance and the need for those things to be taken seriously. And that ties down to the question asked by Juliana as to whether the task force would not consider enforcement of the use of face masks. That is obviously within the jurisdiction of the states, the subnationals and the Federal Capital Territory administration, because they are the ones that have instituted the mobile courts in their various jurisdictions. And they have also signed quarantine laws and given specific executive orders and instructions that have been gazetted in the various states as to the enforcement. When there was an infraction here at the Jabi Mall, it was the task force of the Federal Capital Territory that did the prosecution and secure the conviction of the people that were charged with the management of the Jabi Mall, and when the sentence or the penalties were handed down, it went to them. So there is a structure of operation, and that is why the presidential task force at the national level does not have the capacity of enforcement. And that's why we collaborate and work in synergy and in sync with the sub-nationalities to ensure that these things are enforced. Because enforcement is a very, very important part of the process in which we are. And that formed part of the discussions that we had with the security chiefs and defense chiefs this morning, just to reiterate the need for them to support the national response now that we are easing down and relaxing the processes of the lockdown, that we should not take that for granted, and they have a responsibility. And we also discuss issues of the narratives that are out there that we need to work on and ensure that we address areas of concern that have been raised by the public. So it's an information sharing process, and eventually we came to some certain agreement and consensus about how to proceed. They would also look at the entire response as it concerns their operational guidelines, particularly the military, the police, the security agents, so that at least we maintain an effective response to COVID-19 as the processes of the ease of lockdown and the opening up of several areas within the business sectors to come on stream. Because the entire response has always been informed and guided by trying to secure a balance between lives and livelihood. And in doing that, a lot of things must be taken into consideration and factored into the eventual decisions that will come. We've just started the second phase, and it's good that we are on the same page in dealing with the issues. Don't forget, we have removed the restriction on interstate travel. That comes with its own challenges, because what you are doing basically is that you are opening up the country, and there must be in place certain infrastructure, particularly security infrastructure, to deal with other phases of challenges that might not be COVID related. Because don't forget, we are dealing with insurgency, we are dealing with banditry, we are dealing with so many other things in addition to the health challenges that have been posed by COVID-19. Whether I will advise the president on another lockdown. Well, that's a very difficult question. But if experience is anything to go by, looking at what is happening globally, the conclusion I almost reached in paragraph 3 of my statement was to emphasize the fact that relaxation was cautiously taken by government to balance lives and livelihood, and that we should not allow the experiences of 1918 during the Spanish flu repeat itself. And what happened in 1918 is very, very simple. During the Spanish flu of 1918, it lasted for 2 years and in 3 waves. And during that period of time, 500 million people were infected by the Spanish flu, out of which they recorded fatalities of about 50 million persons. But the dangerous phase of the flu was the second flu, was the second phase. Why was it dangerous? Because people were so angry about the quarantine and restrictions. When governments then of the different nationalities lifted up or relaxed, people jumped onto the streets and began to enjoy themselves with reckless abandon. And by the time the second wave came, it accounted for tens of millions of the deaths that were recorded during that period, until they had the third phase and the flu eased up as a result of vaccines and other things that were put in place. And that brings me to the point of caution, that we have to be extremely careful how we proceed and how we react and how we deal with the phase in which we are now. We are yet to peak, and you heard Dr. Sani say that and Chukwe, that probably we'll be peaking in September. What that presupposes is that we are still in the thick of the war. And nobody should take it for granted, because government has relaxed the lockdown to take it for liberty that COVID-19 has gone. COVID-19 has not relaxed. It's still virulent, it's still dangerous, and even more potent now from the studies that are coming out. When we started as a task force and we were looking at the way the virus was behaving, you gave people the chance of exhibiting symptoms within the period of 1 to 14 days, isn't it? It's not so now. All you hear is that somebody is sick. The next thing you hear is that that person has passed on. So it means that even the period of time that you expect that the virus will manifest itself and symptoms begin to show, it's rather shortened by what we are seeing. I know medically, those of them that are experts in this can attest to that. I'm saying this to drive home the point that COVID-19 has not relaxed. Government might have relaxed the lockdown to allow for balance of lives and livelihood and to restart the economy, because the negative impact on the economy as projected by the World Bank and the IMF is that we end up adding another 5 million before the end of the year or by the end of the year to our poverty bracket. And by the time we are said and done, their projections is that about 96 million Nigerians will be living in abject poverty or in deep poverty. That's a scary figure. So government had to balance this to see. But we expect that we'll receive every form of support and cooperation from the citizens, because now it's a collective responsibility. It's an individual responsibility, it's also a collective responsibility. The government will do its own part, but the citizens too have a major role to play. How would the citizens key in? Very simple. No vaccine, no cure in sight. The projection is that we would expect a vaccine to show up probably in the next 12 to 18 months. And before then, we must take every step as a responsible people and as a responsible government to ensure that we reduce drastically the rate of infections in the community. When we are able to do that, those that will be infected are taken out of the community and into isolation, or if eventually we decide that because of the numbers we now have to in place house management, they'll be taken to management and eventually cared for as bona fide citizens of this country. The only opportunity, fighting opportunity we have as a people and as a country is to take to heart the non-pharmaceutical interventions that have been prescribed. And that is working all over the world. Stay at home if you have to. I had the privilege of speaking to the Christian community yesterday at the interdenominational service, and I told them that we must avoid instances of reckless confidence, as I've seen being exhibited. Stay at home if you have to, because it's scriptural. And I quoted scriptures of the Bible that enjoins people to stay at home when there is danger ahead. It is only a fool that will see danger and go ahead and plunge himself into that danger. That's it. Observe social distancing if you have to go out. Don't congregate in large numbers. Practice basic hygiene of washing of hands or sanitizing of hands. And add to reach respiratory exercises of breathing in and breathing out, so that you can practice that for your lungs and maintain a healthy oxygen percentage in your system. It is important that we know that and we drive it home. Now, back to the question as to whether we would advise Mr. President to consider another lockdown. I've said it here that lockdowns might not be popular now. But what would happen in the preceding weeks would determine. Madagascar has imposed a lockdown in spite of its herbal cure. They have imposed a lockdown. About 39 states in the US, because of the Thanksgiving holiday and the National Day celebration, their National Day celebration on the 4th of June, they have begun to see spikes in their figures in the different states. And the speed with which they were considering the ease of lockdown, a lot of states have slowed down in proceeding further. Like I said in my address this afternoon or this evening, a province of Galicia in the Catalonia, province of Spain, have locked down a specific area that has about 70,000 residents. Even in China, where the virus even started, about 2 weeks ago, I think, in the communities around Wuhan, there were specific lockdowns. Dr. Sani just said, we have now isolated 11 local governments. We started with 20, but the dynamics of the figures that keep jumping every week turn around those statistics. And now there are about 11 local governments that we have advised the subnationalities to consider precision lockdown in these areas. I believe as the days and weeks ahead would present, I would not be speculative as to what would happen in the future, but we will do everything within our mandate to ensure the safety and the protection of the well-being of the people of Nigeria. If that will require a recommendation of a lockdown, this task force will not shy away from its responsibilities. We will take that decision. We will make our recommendations to Mr. President, who will finally decide. But we will first take a decision on our side as members of this task force within the context of the mandate that has been given to us and make that recommendation. But I said, such a decision being taken now or advised now will be speculative. What would happen in the next 2 to 3 weeks would determine what eventually our recommendation shall be. I close by urging us to do everything possible to stay safe, to protect ourselves, to protect our loved ones, to protect our families, to protect our community, and in the overall interest of each and every Nigerian, to protect the entirety of our country and its citizens. Thank you and good evening.
Thank you very much, Chairman PTF on COVID-19. That brings us to the end of today's national briefing, but a few messages have come out. I've been able to tease out about 4 or 5. One is that the growing number of confirmed cases calls for utmost care and vigilance on our part. This virus does not discriminate in any form. It thrives when you fail to adhere to measures. 2, it does not matter how young or old you are. We all need to take responsibility, protect ourselves, and protect our loved ones. 3, as we reopen our economy, we can, at the same time, minimize the risk of new explosive spread, provided that we recognize that we are all in this fight together and that the war is still raging. 4 is that we should remember humanity has only one enemy, and that is the virus. Let us build up our relationship and our knowledge about infection prevention and control rules that have been unveiled to us. Let us educate ourselves, let us create awareness and drive it at the grassroots especially. 5, as we reopen our domestic flights, remember there are protocols. They are for your protection and the protection of your loved ones. Watch out for the publications and educate yourself. Comply with these protocols. 6, this is for our parents and our children who are writing the WAEC exams. The dates have been announced from 4th of August to 5th of September. Please prepare. The keys to future are in your hands. We wish you the best as you prepare and as you go forward to write the exams. Finally, we will not be briefing on Thursday as we will be conducting the midterm review. However, the Minister of Information and Culture will be updating the nation immediately after the media, after the fake meeting on Wednesday. So that will fill in any gap of what has occurred between today and Wednesday. Okay. We will be briefing on Friday when we conclude. Okay, let me qualify it now. We might be briefing on Friday when we conclude the midterm review. So we look forward to seeing you on Friday by the grace of God. God bless Nigeria. Good night.